Welcome to the Endocrine Matters podcast. This podcast episode is sponsored by Complete Medicine and Hey Healthy. Hey everyone, welcome back to Endocrine Matters. I'm Dr. Arti Thangudu, your direct care endocrinologist, and today we're talking about something that I hear about constantly from my patients, and honestly something nobody warned us about. You survived your teenage years, you got through the awkward phase, you thought you were done with acne, and then you hit your 40s and your face said, just kidding. Yep, we're talking about perimenopause acne, the zits and wrinkles combo that nobody put in the brochure. If you're in your late 30s, 40s, or even 50s and you're suddenly breaking out on your chin and jaw like you're back in middle school, first of all, you are not alone. And second of all, there is actually a really good reason this is happening. And there are real solutions. So let's get into it. Okay, so let's start with the why. Because once you understand what's causing this, it makes total sense, even though it's deeply unfair. Your skin and your hormones are in constant conversation. They've been talking to each other your whole life. And for most of your adult years, estrogen has kind of been the peacekeeper in that conversation. Estrogen helps keep your skin smooth, calm, and balanced. But here's what happens in perimenopause. Estrogen starts to drop. It doesn't say goodbye gracefully either. It kind of just starts ghosting you and can be up and down like a roller coaster. Now here's the thing. Your androgens, which are your male-type hormones, and yes, women have them too, we need them, they're totally normal, your androgens don't drop at the same rate. So you end up with this imbalance. Not necessarily more androgens than you used to have, but relatively more compared to your falling estrogen. And your skin notices. Androgens tell your oil glands to produce more oil. More oil means more clogged pores. More clogged pores means more breakouts. And because of where you have more androgen receptors on your face, your chin, your jaw, your neck, that's exactly where the breakouts show up. So that pimple that shows up in the same spot on your chin every few weeks, that is not random. That is your hormone sending you a very annoying message. Now, there are two types of adult acne we see in women. Some of you have had acne since your teens and it just never fully went away. That's called persistent acne, and it can sometimes be linked to conditions like PCOS, now we call it PMOS, and I like that term better. Others of you had perfectly clear skin for years and then suddenly started breaking out after 25 or 30 or even 40. That's called late-onset acne, and honestly, that's more common than people realize. And then there's postmenopausal acne, acne that shows up after your periods have fully stopped. That one is actually less common, and if that's you, it's worth getting your androgen levels checked just to make sure everything is where it should be. That's something I'd want to know about my own patients. But for most of you listening, perimenopause is the culprit. Your estrogen is dropping, your androgens are hanging around, and your chin is paying the price. Now, I know a lot of you have already tried the topical stuff, the retinoids, the azelaic acid, the benzoyl peroxide, and those things genuinely help. They're great tools, and a good dermatologist will often recommend them as part of your routine. But here's the thing. If the root cause of your acne is hormonal, if it is coming from the inside, putting things on the outside of your skin is a little bit like mopping the floor while the faucet is still running. You can mop really well. You can use the best mop money can buy, but until you turn off the faucet, you're going to keep mopping. That's the difference between treating the symptom and treating the cause. Topical treatments address what's happening at the surface. Hormonal treatments address what's driving it in the first place. So if your acne is clearly cycling with your hormones, or it started or got worse during perimenopause, it's worth having a conversation about whether a hormonal approach makes sense for you. Okay, so let's talk about one of my favorite tools for this. It's called spironolactone, and yes, that is a mouthful, so you can just call it Spiro like everyone else does. Spiro has actually been around for a long time. It was originally developed as a blood pressure and heart medication. It's a diuretic, which means it helps your body release extra fluid. But doctors noticed something interesting along the way. Women taking it for heart and blood pressure reasons were coming back saying their skin was clearing up. And that led to a whole line of research into using it specifically for hormonal acne. So how does it work for acne? Remember those androgens we talked about, the ones that are telling your oil glands to go into overdrive? Spiro works by essentially blocking the signal. It sits in front of the androgen receptor. Think of it like a bouncer at the door, and it says, "Not tonight." The androgens are still there, but they can't get in to cause trouble. Less signal to the oil glands means less oil, less clogged pores, and less acne. It also has a mild effect on reducing how much testosterone your body produces in the first place. The result is that over time, and I want to be honest here, it does take time, usually a few months, to see the full effect. Your skin starts to calm down. Now, Spiro is what's called an off-label treatment for acne. That means it wasn't originally approved specifically for acne, but it has been studied extensively for it, and the American Academy of Dermatology actually recommends it for women with hormonal acne. So this is not some fringe idea, it's a well-established evidence-backed option. The dose is usually started low and can be adjusted based on how your skin responds and how you tolerate it. All right, let's talk side effects because I know that's what you're wondering about. The most common ones are pretty manageable. Some women notice more frequent urination, especially when they first start. Remember, it is a diuretic. Some notice breast tenderness or headaches, and some notice changes in their period. It can become more irregular, especially at higher doses. Now, I've seen comments from people online who are nervous about Spiro because they heard it can raise your potassium levels. And yes, that can happen. It's something worth knowing about. However, I want to reassure you that in healthy women without kidney problems or other significant health issues, the risk of dangerous potassium elevation is actually quite low. It's not something most young, healthy women need to be intensely worried about. That said, your prescribing doctor should know your full health history, and if you have kidney issues or take certain other medications, that's a conversation worth having. One important thing, Spiro is not safe to take during pregnancy. It can affect how a male baby develops. So if there's any chance of getting pregnant, reliable contraception is a must while you're on it. What Spiro does not do, and I want to say this clearly because I know there's anxiety around long-term medications, it does not increase your risk of breast cancer or gynecologic cancers. The research on this is reassuring. Overall, for the right person, a healthy woman with hormonally driven acne, Spiro has a pretty favorable safety profile. It has been used for decades, and we know it well. So who is the best candidate for Spiro? Honestly, women whose acne clearly has a hormonal pattern, the chin and jaw breakouts, the flares around your cycle, acne that got worse or started during perimenopause, that's the sweet spot. It is also a great option for women who can't or don't want to use birth control pills, which are another hormonal option for acne, but which carry their own considerations, especially as we get older and cardiovascular risks go up. Now, I also want to say if your acne is severe or if you've been struggling for a long time with really stubborn, painful cystic breakouts, please see a dermatologist. I mean that. Dermatologists are the experts in acne treatment, and they have tools including prescription topicals, antibiotics, and things like Accutane that need specialist oversight. I'm not here to replace that conversation. I'm here to help you understand the hormonal piece so that if you do see a dermatologist or if you're already seeing one, you can advocate for yourself and ask the right questions. Spiro is also something a dermatologist can prescribe, so if you bring it up at that appointment, that's a completely reasonable conversation to have. Okay, let's wrap up. Perimenopause acne is real, it's incredibly common, and it is not your fault. It's not because you're not washing your face right or eating wrong. It's your hormones going through a major transition, and your skin is reflecting that. The good news is we have real tools to address it at the root cause. Spironolactone is one of those tools. Well studied, widely used, and genuinely effective for the right patient. It's not magic and it's not overnight, but for a lot of women, it is genuinely life-changing. If you're dealing with this, talk to your doctor. Ask specifically about hormonal acne. Ask about Spiro. You deserve to be taken seriously, and you deserve clear skin at every age. If you found this helpful, please subscribe, leave a review, and share this with a friend who is also fighting the zits and wrinkles combo. We're all in this together. I'll see you next week on Endocrine Matters.